Microneedling, it's something that we all need. No matter what, you need it. As long as you don't have any contraindications to the treatment, it's something that we all can benefit from. It is a device that we use that has tiny needles on the end of it. It creates these micro injuries in the skin that then stimulates collagen and elastin in the skin. So we do put like a topical numbing on you to make it a little bit more comfortable. That glides all over your face. You can add PRP to it if you'd like, and then that just gives added benefits. It's good for fine lines, wrinkles, texture, pore size, acne scarring. Honestly, it's a great treatment for everyone that I would definitely recommend.
Are you noticing yourself waking up with jaw soreness, headaches, or that your teeth are looking worn down? You might be grinding or clenching at night without even realizing it. That's where a night guard can make a big difference. It's a custom fit appliance that creates a protective barrier between your teeth. It helps reduce wear, protects against fractures, and eases pressure on your jaw joints. The best part, we make your night guard right here in our office using a digital scan, no goopy impressions. So it's precise, comfortable, and ready quickly. A small night guard can help protect your smile for years to come.
My name is Christy Nowak. I am Dr. Dolan's sister-in-law, but I'm also a nurse, been nursing for 12 plus years now. I worked at Abington Hospital. I was a surgical nurse, dealt with trauma patients, post-operative patients, so always have been taking care of people. And I love the confidence that I bring to my patients, and it's just a great place to work. When you're coming in and you're insecure about maybe your smile or wanting to have your teeth brighter or having pain and need different things fixed in your mouth, that affects the way you smile and how other people feel when they look at you. If you're smiling and you're confident with how you feel and with your face and your teeth, the combination of both of those things together, I feel like embody the whole package. The services that I will be offering will be Botox and your derma fillers, as well as some microneedling treatments, chemical peels, and then incorporating some of your body's blood products and using PRP or PRF to stimulate collagen in the skin and do a more conservative route for facial rejuvenation. Who knows where we'll be in a couple months, but it's only growing here at Dolan Dental, so there may even be some new treatments added onto our packages. It's a dental office, so you don't anticipate having this extra luxury added onto your treatments, but you can come in for your filling or your cleaning and then come and see me a few weeks or months later and get a little aesthetic treatment to make yourself feel even better, while Dr. Dolan and his staff can work on fixing your smile and make you smile a little bit more. I can maybe work on tweaking a little bit of your skin or adding a little bit of glowiness to the face. They're working on making you feel good about your smile. And if you're fixing your smile, why not feel like you could add something to your face or tweak something to make yourself feel even more confident about yourself, or play with your skin and try new products or new treatments to make the whole package come together. It's happiness. It's making you feel happy. When I first started out in aesthetics, I was using a bar of soap on my face. When I started to incorporate medical grade skincare into my regimen, I started getting some Botox, some fillers, microneedling, all these different treatments. I really started to come out of my shell. Dr. Dolan has also helped work on my teeth, brightening, Invisalign. So I think the combination of those two things can really make a difference in how you feel about yourself.
What do you love most about doing what you do?
Making people feel good. I love the confidence when they come back. I love when I see them at their 2-week follow-up, or they'll send me a picture or a text message, and I just love how they feel about themselves. And then knowing that I maybe help them feel a little bit better too. Dr. Dolan and his staff embody everything that I'm about, making our patients feel their best. So I really feel like I fit in just right here. My goal is to make you feel your best. I want to make you feel like $1,000,000. I want you to feel confident. I am very conservative in treating your face. I don't want you to look not like yourself. I want you to look like you, just turned up a notch. I care about you. I'm passionate about what I'm doing. I want to be here. I know you want to be here. You're signing up for a service, and I'm signed up to give that service to you. I want to make sure you're happy. I always follow up with my patients and make sure that you had an incredible experience. I'm here to make you feel your best without looking not like yourself. You want to feel your best, you want to look your best, and I'm here to help you do that.
So a little background, I have sleep apnea. I was using a CPAP machine. It worked pretty well, but it was kind of cumbersome putting it on and then keeping it on through the night. So I'd have it and I'd end up ripping it off halfway through the night to go to the bathroom, try to get it back on again. And by the time I got it on, I would wake up. So I saw this other sleep appliance opportunity, I guess, and it was advertised. It's a mouthpiece that goes in and kind of pulls your jaw out a little bit, so you're not collapsing your back of your throat, which is what happens during sleep apnea. I brought the other appliance that I had in to Dr. Dolan, and we took a look at it. It was cracked, and I guess the integrity of the material was not quality, or not. I'm sure it was good quality, but as over time things get better, we just started talking about it and got into this particular one, and just did that kind of work out well. We just talked over time about the importance of sleep just in general. So many studies now talk about how important sleep is. Just kind of went down that road of why sleep and what happens during sleep apnea and how that can affect everything else. It's better to use an appliance like this and be able to keep it on all night versus maybe a CPAP machine you might use for a couple hours. So that was kind of the rationale, kind of the discussions that we had early on. There's a big percentage of people that get it, have it, don't wear it. Like, go wear it for a while, like me. Like, I wore it, I did wear it, but I wear it for like the first half of the night, and then like I wouldn't put it back on again because it's just, you're tired, you come back to the bathroom, like I don't like, and you can't, if you wear glasses, it's a pain in the ass. If you're at night, you're trying to watch TV, well, you got this mask and it's kind of coming around and like you can't really put your glasses on. So this is way more convenient, but does it work as good as? Probably not. But if you're not going to use that, it's better than nothing. Yeah, I'm sure people don't think coming to a dental office like, oh, I have sleep apnea. Like, I don't think they would connect the two. I know from the pulmonologist that I see at the sleep center where I originally got the CPAP machine. After a while, I think the first line of defense is the CPAP machine. And then they'll say, if that's not working, here's some other options. And there's different ways you can go, and one of them is the sleep appliance. So the pulmonologist did mention that, over time, we just continually talked about it. Then I started, coming in, and we just You know, as I mentioned before, he's just like, I could do that, and he had some good, labs that he worked with. So I know, I mean, I just feel better in the morning, but actually to see it on, on your app, it's like, oh, okay, I had a really good night's sleep. Well, the staff here is, fantastic. They do a great job. I mean, it's a beautiful office. Everybody's super friendly, super nice. There's so many people that we know have already, come to Dolan Dental, and it's a great experience. You look at the reviews, and that kind of tells the tale when you see how many reviews and how many people talk about Dolan Dental in general. I mean, he's not just my sleep appliance, physician. He does everything, and he's done a great job just with dental work for myself and my family, my kids, my nieces and nephews. So it's been a great experience for sure.
Easy gel is one of my favorite treatments. It's something that is good for people that are afraid of filler or want to do something more natural. It's made off of your own blood, so it's only as good and as healthy as you are. The natural filler, so what we do is we draw your blood, spin it at different rates. It then we separate it into your albumin and your platelet-rich fibrin. Those two then get cooled and heated, and then we mix it together and it becomes like a gel-like substance. After that substance is created, we can inject it in various different areas. Once your body starts stimulating collagen, that's when results start to happen. So get injected anywhere you'd like. Honestly, that filler can go. It's the same in that way. Just has a little bit more safety to it and is good for the person that wants a more natural look.
So at our office, we offer a couple types of sedation. We offer laughing gas, which really calms you down, very easy and reversible, very safe. But we also offer oral sedation. So oral sedation is when you take a pill about an hour hand before. It really does calm people down. We also do offer general anesthesia, put you totally under, where obviously you're not going to remember anything. Whatever we can do, we're going to try to do to make you feel as comfortable as possible to get the best treatment you need. We will go over the steps and try to figure out which sedation option is best for you. Come in for your free consultation. We can explain a little bit more about the details and go over options.
Hi, I'm Dr. Kara, and I'm a dentist here at Dolan Dental. SureSmile is a very comfortable and discreet way to straighten your teeth. It uses clear aligners that are nearly invisible to shift your teeth in a really comfortable, gentle way that's really efficient. It usually takes about 6 months to a year, and we try to do it in a way that's as quick but as effective as possible, so it doesn't take too long, and it's a good way to get the results that you want to straighten your teeth in a fast way. A lot of patients come in actually with biting pain because their bite is off. I always tell patients SureSmile is awesome because, of course, it's cosmetic, it can get your teeth straight, but it also helps with your bite. So when you do SureSmile and straighten your teeth, not only are you aligning them and it's really aesthetic, but you're straightening them in a way that you're functioning better, you're cleaning your teeth better, and you're chewing better. So it's less painful if you're having any pain. If you're a patient that has chewing pain, or you've had braces in the past and you stopped wearing your retainers and your teeth have shifted, or if you're having trouble cleaning your teeth, if your teeth are really crowded, or if you're getting food stuck in your teeth and you're constantly cleaning and you're looking for a way to straighten and also make it easier to be hygienic at home, SureSmile is a great option. You don't even need to wear brackets and wires. These clear aligners are hygienic. You take them out to eat, but you wear them throughout the day and no one sees them. The smile design process is really simple. We take a digital scan, no goopy impression, and then the doctor and the assistant go over how to make your smile where you want it to be. Whether or not you're dissatisfied with the shape, if there's chipping in your teeth, the color. We have a very high-tech process where we can design it digitally and then print a mock-up on your model, on your teeth, so you can see what it would look like prior to getting any treatment done. So it looks exactly like your mouth. It's very accurate. So when the trays are made, they're custom made and they fit exactly. I've only had positive feedback about SureSmile. Patients find it so easy to do. The aligners fit perfectly. They have no pain. And at the end of the day, when the results are done, not only are they super satisfied and happy with the aesthetics, but they can clean their mouth better. They're not having any pain that they had before, and they're chewing and functioning so much more easily because their teeth are aligned. At Dolan Dental, with our smile design, we want to be able to create a smile for you where you feel empowered. So every time that you smile at someone, they're able to see your happiness and your confidence.
We offer a lot of different implant solutions here. Dental implant essentially is a tooth replacement. The reason it's the gold standard, it looks great, it's relatively painless. The other options involve either removing a tooth at night before you go to bed or shaving down your other teeth. An implant, it can't get cavities. It's very predictable and you're able to floss it and treat it like a normal tooth. If you were to break one tooth, we can replace that with a single implant. You know, we extract the tooth and we put the implant in, let it heal for a couple months, and then we screw the tooth part on top. We also offer full mouth options. If you're missing multiple teeth or multiple teeth were broken down, we have a couple different options. We extract all your teeth, we put in a couple implants, and we can either have a denture that snaps in and snaps out, or a bridge that's screwed into your mouth. Really a true tooth replacement option. So implants offer us a lot of different options. Every mouth is different, every case is different, and we have a solution for each case depending on that person. After doing the cases, I sit down and I have a smile on my face knowing that I changed that person's life.
If you snore at night, wake up tired, even after a full night's sleep, you could be experiencing sleep apnea. a condition where your breathing pauses or becomes shallow while you sleep. When the airway collapses, oxygen levels drop, and your brain wakes you up briefly to start breathing again. This can happen dozens of times an hour, preventing deep, restful sleep. Untreated sleep apnea doesn't just cause fatigue, it can increase your risk for high blood pressure, heart disease, and daytime drowsiness. But the good news is there are comfortable, effective treatments, including a custom dental appliance. One of the most advanced options available today is the Panthera Sleep Appliance. It's a small, lightweight device worn at night, custom made to fit your teeth perfectly. It works by gently moving your lower jaw slightly forward, keeping your airway open while you sleep, reducing snoring and helping you breathe normally all night long. Each Panthera appliance is digitally designed and 3D printed for precision, comfort, and durability. It's easy to clean, discreet, and completely custom to you.
I'm Dr. Matthew Stewart, and I'm a dentist here at Dolan Dental. Probably used to going to the dentist where you're getting big impressions of your mouth, doing it the old analog way. And here at Dolan Dental, we use the technology to our advantage and make that much more easy for the patient. We use the CEREC scanner, and it provides just a much more ease of treatment, more comfort for the patient in order to get the proper treatment, in order to get their smile back, as a much smoother flow throughout the appointment and for the patient's comfort. Some patients are very surprised at how much technology we have here, but a lot of patients come to us because they want that experience and they expect that experience in the dentist. So as you can see there, she's got prepped down for a crown. Basically what we do, this is basically after we've done all the treatment on the patient, and then we take the scan and then we prepare it to get milled in the milling machine. And once we get that scan done, we hit the design, and then we can design your crown exactly how we want, to the exact dimensions to make it the perfect fit. Take and just look at just the crown. You can see exactly how it fits and how it's going to fit in between the adjacent teeth. It helps just to know the product that you're getting, not only from us as the dentist, but also for the patient to know that they're actually getting a crown that's going to last and that's going to be a very good fit for the rest of their life. Using a scan like this, not only can we prepare a crown or a bridge for you, but we can also look at your smile and see how your bite comes together, and if maybe a different kind of treatment such as Sure Smile or clear aligners would benefit you and have proper bite to be less traumatic over the course of your life, and one scan to use in different ways to help your treatment. So here at Dolan Dental, we use technology to our advantage. We have multiple scanners here in the office. We have the state-of-the-art facility, a CBCT X-ray that we can evaluate every tooth and every aspect of your mouth to get your proper treatment and find any issues that may come about, so we don't miss anything. Here at Dolan Dental, we provide state-of-the-art treatment and care for our patients. I'm Dr. Stewart. I'm new to the practice here, and if you see me around, I'll be more than happy to introduce myself and get to know you and become part of the Dolan family with you.
I'm Dr. Lay, dentist here at Dolan Dental. We provide full mouth implant rehabilitation, which means if you have a lot of broken teeth, missing teeth, we're able to restore function and aesthetics by replacing your teeth with a full set of implants and prosthetic teeth. When we start with the end in mind, we work together with patients to see how we want to design a smile. We leverage our technology to create the best patient care possible. We like to use something called a smile design. This is where we take pictures and use AI-generated software to figure out how your smile would look, to see if we're happy with that and how we might want to proceed to get to that smile. The technology that we bring here combines accuracy and precision to really make sure that these implants and teeth and smile fit the way they need to ensure a long-lasting and predictable smile.
Jack was born with a rare genetic disease called ectodermal dysplasia. And what happens is, so he was born without sweat glands, and he was only born with 7 teeth. He was under the care at University of Penn from age 3 to age 12. When he was younger, the teeth really didn't matter and bother him. His appearance didn't matter to him as he was younger, but as he was getting older, 6th grade, 7th grade, and he didn't have the teeth, even though we had dentures, they didn't fit well, they didn't work for him to eat. And I'll never forget running into Dr. Dolan before he was Dr. Dolan when he was at Temple, and he told me he couldn't wait to get his hands on my son to help us through our journey. When he started his own practice, we came up here, and it's been life-changing for my son ever since. When we were at University of Penn, everything was so old school. When they did impressions, they would fill his mouth with like concrete. It was awful for a kid to go through. He's probably got like 2,000 hours in a dental chair down there. So when we came up here, everything was so different. It was state of the art. It was cutting edge. Dr. Dolan and Teresa, they threw a game plan at us. Instead of a full denture up top, they wanted to give him permanent teeth here. And it's something that we had never heard because we were just looking at full dentures. It was something that was never even in our plan. It was their plan. And just like he's about to get a new bottom denture, and I said, whatever you want to do. It doesn't, whatever you tell us to do, you're going to do it, and you're going to do it the best that it can be done, because that's just how they do it. To see what they did to him and his first smile, to where he didn't have to take his teeth out here. You just saw his confidence level go up. You saw everything go up.
It's been great. It's so much different, and I just like it better up here. It's like more like modern, the new technology. It just was more simpler, and just like, it didn't like hurt when they were giving the impressions. It felt good, like when they were doing all the work in my mouth. It felt amazing. My mouth was like full. I could like fully smile. It also helped me eat better. Like I could chew it much better, and it just like made my confidence go up a lot. Makes me feel great. Like more confident, more happy about myself.
I put a post on Facebook about it, and Jack has a lot of people in his corner. I think there was over 1,000 comments. You know, I mean, I'm tearing up now. So there is an ectodermal foundation that we're a part of. I have put out Dr. Dolan to the foundation to let them know that, you know, when you get smacked in the face with something, and as a parent, you try to figure out, as a parent, you always try to figure out what is the best way to go about something for your child. I got to be dead honest with you, and I know that, you know, this is going to be on Dolan Dental's thing, but they really changed his life, and I can't be any more appreciative for them.
So dental implants have become the new standard of care. We have incredibly high technology here at our office, where we do a lot of planning, determine where we should be placing your implant, An implant process is anywhere from 3 to 7 months long, depending on where we're starting with. It is a fully functional tooth at the end of the result, something that you're able to floss, something that does not get a cavity and should really last forever. If you are interested in a consultation for a dental implant, feel free to reach out. We do full, free consultations, x-rays included. We would love to meet you and see how we can help you.
Imagine being able to see your new smile before any dental work even starts. With Smile Cloud AI, we can design your ideal smile using just one photo. The software maps your facial features, tooth shape, and proportions to create a personalized digital smile preview within minutes. This isn't a generic mock-up. It's a realistic design tailored to your face so you can visualize the results and feel confident in your treatment plan. Whether you're considering veneers, whitening, or a full smile makeover, Smile Cloud helps us plan with precision and helps you make decisions with clarity.
My name is Dr. Raul and I'm a dentist here at Dolan Dental. We begin by trying to make our patients feel comfortable just right off the bat. Coming into the waiting room, coming into the treatment room, having them meet our staff. To me, that's half of the battle. Have the patient on your side and make sure that they understand who you are and what you're doing. It is super important to me personally, and I think there's a general philosophy here, that patients know what's happening. That first step to me is a big hurdle. I take pride that we do things differently in that way, that we have patients feel at ease here. The next step is just having a plan, which we do digitally, and then executing. And executing is basically a 1-hour procedure. Implant surgery really isn't something that patients complain of pain or complain of discomfort. Once we get over those two things, it's just letting our expertise take over. This sort of applies to dentistry in general. It's a lot of unknown. Patients want to understand more what exactly it is, what the process is like. There's a bit of a misconception because implants are placed in your jawbone via a small surgery. People in general are scared by the word surgery. It sounds big and invasive and painful and uncomfortable. And I think one thing that we are able to achieve here is, yeah, it's still surgery, but it's comfortable. It's not this big procedure that people have in their mind. And a lot of times when I'm done with my patients with implants, I ask them, what did you think? Did your mind change a little bit about implants? And they say, yes, this was way easier and simpler than I thought. The number one concern I hear from patients is the fear of it being a big, painful surgery. Implant dentistry has advanced to a point where we can, in one appointment, in a short time, put an implant in your jawbone pretty seamlessly, and patients sometimes are even surprised that they didn't feel much pain. One thing that we do at Dolan Dental that's a little different from other general dentists that do implant is from the planning to the execution. Because we have all the technology and the capabilities, we're able to, with just one visit, make a virtual surgery. Step one is an exam and evaluation. We need to take a look at your mouth, take a look at how your teeth relate to each other, see how many teeth you have, take a few x-rays. To me, it's very important to look at a 3D x-ray. We take a cone beam tomography here that we have in the office. When we're talking about implants, we need to make sure that we have good quality bone, so an implant can be placed safely in the bone and last a long time. That 3D x-ray will show me not only the quality of the bone that's in there, but it'll allow me to see how much bone I have vertical and horizontal, and it'll tell me, yes, this is a good candidate for an implant or not a great candidate for an implant. So if they are a good candidate for an implant, we plan the surgery so that 3D x-ray that we take allows me to plan everything digitally and basically measure where I want the implant and take that measurement into surgery with me with a surgical guide. So once we see the patient and we determine that the patient's a good candidate, the next step is basically surgery. Surgery sounds big, but it really is a small procedure when we're talking about replacing 1 or 2 teeth. It takes around 1.5 hours, depending on how many implants we're placing. And nowadays, with the technology that we have, we're able to do this pretty, I don't want to say quick, because quick sounds like it's not well thought, but it's quick because we've already spent the time planning without the patient being in the chair. So we do it all digitally. When the patient comes here, we know exactly what's happening. Contrary to belief, implant surgery can be pretty painless. I've had a couple of patients come back for the post-ops and say, "Doc, that was really, really nice. I didn't feel a lot of pain. Of course, a little bit of soreness. It was indeed a small surgery. We can make it virtually painless."
These are great replacements or substitutes for a conventional denture. So for conventional denture, it just rests on soft tissue. There's no real fixation to anything here. With overdentures, it's more like a button that snaps on from the teeth to an implant or even a natural tooth. So instead of having something that's loose all the time and flopping around on you, you have some sort of stability with a denture, overdenture, and that gives you more chewing function and more confidence in your teeth staying in your mouth.